you have a total of 12 pairs of cranial nerves coming off your brain. Now, most of these are coming off the brainstem, as we saw when we talked about the central nervous system. But they do range all the way from underneath the actual cerebrum all the way down into the medulla. So these 12 pairs of cranial nerves comprise sensory, motor, or mixed, both sensory and motor. So we'll need to go through all 12 of these different cranial nerves, understanding the names, locations, are they sensory, are they motor, are they mixed, and some basic functionality of them as well. They're identified based on name and Roman numerals. So for this, you make sure you know both the name and the Roman numeral, because depending on questions and different references, sometimes they're referenced by their numbers in Roman numerals, sometimes they're referenced just by their names. So understanding both name and Roman numeral will be important. Looking at the 12 cranial nerves, making sure we know them by name and number, and they're all paired. Here is the first pairing, the olfactory. Now to orientate, we're looking at an inferior view going up of the brain. The olfactory are more anterior. Think nose anterior, makes sense. Now, as we go through these, I'm only going to highlight the one side, not both sides all the time. So here is the optic nerve. You can see they're kind of side by side. They would be heading out to the eyes. Optic nerve, cranial nerve number 2. Then we have oculomotor nerve. That's cranial nerve number 3, sitting right there. From there, we move on to the trochlear, which is cranial nerve number 4. If you kind of notice, they're heading in order from anterior to posterior. We then have the trigeminal nerve, which is right here. You can see it's a little thicker. We'll get to that why in a second. Then cranial nerve number 6 is right here. That is the abducens nerve. Cranial nerve number 7 is this section right there. That's the facial nerve. Which leaves us with cranial nerve number 8, which is just past the facial nerve. Cranial nerve number 8 is the vestibulocochlear nerve. We then have cranial nerve number 9, which is this section right here. That's the glossopharyngeal nerve. Moving to cranial nerve number 10, which is this section right there. That's the vagus nerve. Cranial nerve number 11 is the accessory, also known as the spinal accessory nerve. Reason being for that one is some of the rootlets, some of the base parts, are coming off of the spine, not the brainstem actually. And cranial nerve number 12, the hypoglossal nerve, is right there. Now notice that's the only one of the 12 cranial nerves that didn't follow in order. Otherwise, they're all going from cranial nerve 1 right back through to posterior, anterior to posterior. 12 is the only one out of order. So as long as you can count from 1 to 11, you can count these right in order, and you have your 12 cranial nerves by remembering 12 is just a little more anterior in the brainstem. All right, let's start with the first one. We need to go one by one through all these cranial nerves. Cranial nerve number 1 is olfactory. Olfactory is smell. It's a sensory-based neuron. Now this neuron's clustering, this nerve for that matter, you can see you having all these branches going right down into your nasal cavity. So it makes sense that it's smell. So for each one of these nerves, understanding location, name and Roman numeral, is it sensory, motor, or mixed, or both? And then at least a basic function. This one is smell, obviously. Cranial nerve number 2 is the optic nerve. Now this view and this image, we're looking at from a superior down, kind of cut the brain and looked at a superior view. You're noticing the optic nerves are these portions right here and right there. Because those optic nerves are come together, and right here, where they come together is called the optic chiasma. It's kind of where the nerves come together and then they kind of swap and branch off. You'll notice that you have both a purple and a green in both eye. That means you have neurons and inputs from each eye going to both the right and left sides of your brain. So this is vision, of course, and it is sensory based again. So a purely sensory nerve. That's cranial nerve number 2 the optic nerve. Cranial nerve number 3 is the oculomotor nerve. Now you're thinking oculomotor, ocula eye. Well, the oculomotor nerve is eye movement. It's a motor nerve. That means this is going to help control your eyes as they're moving around and focusing on different things. It also aids in opening your eyelids, in the constriction of your pupil, which also then helps with the lens and focusing. So it does more than just simply move the eye. It's helping with focusing, constricting the pupil, moving the eyelid closed. It's dealing with several different aspects, but all of it is motor output, trying to help control movement and structures of the eye. So we're looking at oculomotor. Cranial nerve number 3 is a motor nerve, eye movements. Cranial nerve number 4 is going to be the trochlear nerve. So cranial nerve 4 is trochlear. And just like cranial nerve 3, this one is also a motor nerve and based on eye movements. So this is the second cranial nerve now that is based on eye movements and a motor nerve. Cranial nerve number 5, the trigeminal nerve. Well, tri meaning 3. Trigeminal nerve has 3 primary branches to it. You're going to have the ophthalmic branch, or known as the ophthalmic zone. You're going to have the maxillary branching, and then you're going to have the mandibular branching. Now, this trigeminal nerve is a mixed nerve. That means it has both sensory and motor axons found within it. So it's bringing sensory information in and sending motor information out. Now, the ophthalmic and the maxillary are only sensory. The mandibular is the one that is mixed, has both the motor and the sensory. So let's look at the ophthalmic. Ophthalmic, touch, temperature, pain receptors. This is all sensory information coming in from your face there, from these zones we showed. Maxillary, touch, temp, pain. Sounds kind of familiar because ophthalmic and maxillary are doing the same thing, just different locations. Ophthalmic, you can see, is the upper face, while the maxillary is more of the middle. So looking at the upper, looking at the middle, which means mandibular better be covering the lower portion of it. And if we get to mandibular, you can see mandibular is also touch, temp, and pain, but from the lower aspect of the face. So the 3 different regions of the face based on the 3 different branches of the trigeminal nerve. But that was all just sensory. Remember, this is a mixed nerve, which means we have a motor output also. The motor output is dealing with mastication. Mastication is chewing. So it makes sense that you have the mandibular being the mixed portion. It's going down to where your mouth is. So mouth, mastication. You're chewing down here, which is the motor output. So this is the trigeminal nerve. 3 branches. The first 2 branches, ophthalmic and maxillary, are only sensory. Mandibular is sensory and motor. That's where the mixed comes in. And then cranial nerve number 6, abducens. Abducens is again a motor output. Abducens is dealing with eye movement. That means we have 3 different cranial nerves now that are helping to control eye movement. Why would you need 3 different cranial nerves? Well, think about your eyes. Think about how precise the movement is, how exact. You're moving a millimeter or even a fraction of a millimeter at a time. You can track objects across your field of view. That needs a lot of nervous control to make sure all these movements are precise, are accurate, and you're able to focus and watch things. So the high amount of innervation, 3 different cranial nerves, is allowing for the very precise, very accurate actions of your eye movements. So cranial nerves 3, 4, and 6. Just looking at the abducens as number 6. Remember what 3 and 4 are? oculomotor, and trochlear nerve. So that is going to be the first 6 cranial nerves. Now we have 6 more to cover, but the first 6 we've gone through, learning about location, learning about their action, sensory, motor, and mixed. What are they and what are they doing?